Hey everyone, let's try this again. Okay, so yesterday I put out a video on tennis elbow, okay? I talked about how tennis elbow is often not actually tennis elbow, okay? Meaning it's not like an inflammatory process at the elbow. It's actually due to, a lot of times, an irritation of the nerve that goes down the arm, okay? So one of the things, I just want to show you like 3 self-treatments that you can do at home for tennis elbow, all right? So the purpose of these treatments is going to help kind of like get the nerves to move a little bit better. What's up, CJ? What's up, buddy? And it's also going to kind of desensitize your brain and your body to specific movements, all right? So the first thing I want you to do, David Stern, what's up, man? The first thing I want you to do is just like picture your arm kind of like a big ribbon or a rope, okay? What I want you to do is I just want you to, I'm going to do this seated, all right? But you're just going to take your arm and kind of just do like big circles with it, okay? And you can kind of get your body flowing into it too, all right? I would do this for like a minute or so. You may feel a stretch. You don't want pain. You definitely don't want any numbness or tingling if you have that as well. But notice I'm kind of just rotating my arm, right? So just a gentle way to get the nerves moving, okay? That's number 1. A minute, okay, at a pop. Let's do it like 3 to 5 times throughout the day, okay? The other thing you're going to do, second little exercise, is you're going to take your hand, okay, and you're going to kind of like drive it forward as if you're reaching for something. And as you do it, you're going to look at your thumb, okay? So again, this is painful. Tells your body you're going to work. All right, cool. Sorry, Mom. Anyway, so you're going to look at the thumb, okay, and just kind of drive it forward, all right? And again, shouldn't be painful. If you need to make it more intense, you can make a fist, okay? Even put your thumb inside the fist, okay? Kind of just reach. Again, gentle, never painful. Just feel a little bit of a stretch, okay? And a twist there as well, all right? So we've got that. It's kind of a second but more progressive stretch. And what I want you to do is, again, do that for like a minute or so, 3 to 5 times throughout the day, all right? And the last thing is basically kind of like a self-hands-on treatment that you can do to kind of decrease the sensitivity of the elbow itself, all right? So I'm going to do this, my head's going to be out of the camera here, but I'm going to do this standing. You can do this equally as well seated, and it's actually easier that way, I think, okay? So what you're going to do is you're going to stand, okay, I'll do it head on. So let's just say my right arm is the problem, okay? And usually, right, the pain is right around this area, okay? So what you're going to do, if this is the elbow crease, all right, you're just going to take your hand just like this. Again, here's the elbow crease. You're going to put it just below the level of the elbow, all right? What you're going to do is get a baseline, right? Because how do you know if something's working? We'll test it before and then do this maneuver and test it again, okay? So just go ahead and just kind of squeeze, right, and get an idea of how much discomfort you feel in the elbow. And then here's what you're going to do, okay? So you're going to use your knee in this case. Again, you can do this seated to block the upper arm, okay? And you're going to flip the palm down, okay? So the upper arm is blocked, and you're going to take your hand, just like I showed you, not on the elbow crease, but slightly below, and you're going to push it straight across, okay? So push it straight across. You'll need some good force to do this, okay? Push it straight across. Then, you can't see it, but I'm actually gripping, okay? So push it straight across, grip, release the grip, and then let off. So push across, grip, release the grip, and then let off, okay? So do this for like 10 repetitions or so. Glide on, squeeze, grip off, pressure off, okay? So it's important that you put pressure on, then you squeeze, okay? You let go of the squeeze, and then you take pressure on, or pressure off, okay? So pressure on, squeeze off, pressure off, all right? Try that for like 10 reps. Try that 3 to 5 times throughout the day again, okay? It will most likely be useful for you if when you're doing it, you notice that your ability to grip is actually half as painful as it was before, okay? So if you're doing it, you notice that you squeezed before, you felt, say, I don't know, X amount of pain, let's just say a 5 out of 10, okay, where 0 is no pain and 10 is the worst pain ever, all right? And then when you glide it across, you have now like a 1 to 2 out of 10 pain, okay, when you squeeze. It should be pretty helpful, okay? So I want you to try that out. Again, just teaches you how to get your nerves moving, desensitize your body to those specific painful movements, and kind of loosens up the elbow, okay? So give them a try. If you're in the Royersford, PA area and you have elbow pain, that's terrible and it's keeping you from doing the things you want to do, call at 484-552-3767. Yeah, so take care, everyone. Have a good night. Try those things out, okay?